Which of the following best describes the primary role of an ACSM Certified Exercise Physiologist, ACSM EP, when developing exercise programs for clinical populations? A. To prescribe medications that optimize physiological performance during exercise. B. To diagnose cardiovascular disease and provide medical treatment. C. To design and implement safe, effective exercise programs based on clinical guidelines and client assessments. D. To focus primarily on aesthetic outcomes and competitive athletic performance. 2. During an initial assessment, a client presents with hypertension and a sedentary lifestyle. What should the ACSM EP prioritize before initiating a vigorous exercise program? A. Obtain physician clearance and design a gradual exercise progression emphasizing aerobic conditioning. B. Begin resistance training immediately to improve strength and reduce blood pressure. C. Avoid exercise until hypertension is fully resolved through medication. D. Focus on flexibility exercises only to minimize risk. 3. According to ACSM guidelines, which method best assesses cardiovascular fitness in a low-risk adult client? A. Maximal treadmill test using direct VO2 measurement. B. Submaximal cycle ergometer test estimating VO2 max. C. 1 repetition maximum bench press test. D. Wingate anaerobic power test. 4. Which of the following is the most appropriate adult learning strategy when teaching clients proper exercise techniques? A. Use technical terminology and minimize visual demonstrations. B. Encourage passive observation to avoid client errors. C. Provide hands-on practice, immediate feedback, and active participation. D. Focus solely on lecture-based instruction. 5. A client exhibits dizziness during a graded exercise test. What is the appropriate ACSM EP response? A. Continue the test while monitoring heart rate. B. Immediately stop the test and monitor vital signs. C. Encourage the client to push through for data accuracy. D. Decrease treadmill speed but maintain incline. 6. When designing an exercise curriculum for cardiac rehabilitation clients, which adult learning principle is most relevant? A. Learning is best achieved through strict repetition and memorization. B. Adults are self-directed and learn best when material is applicable to their goals. C. Adults prefer not to receive feedback during training. D. Adults require constant supervision to retain information. 7. Which of the following best describes a formative evaluation in exercise physiology education? A. A final exam that assesses overall learning outcomes. B. Ongoing feedback provided during the learning process to improve performance. C. A peer-reviewed publication evaluating research methods. D. A certification board exam assessing national standards. 8. An ACSM EP is conducting a training session for a group of older adults. Which communication strategy is most effective? A. Speak rapidly to maintain engagement. B. Use technical language to demonstrate expertise. C. Use clear, concise, and supportive verbal and nonverbal communication. Provide no visual cues to ensure verbal processing. 9. According to ACSM guidelines, what is the minimum recommended frequency of aerobic exercise for general health improvement? A. 1 day per week. B. 2 to 3 days per week. C. 3 to 5 days per week. D. Daily high-intensity exercise. 10. When mentoring a new exercise physiologist, the most effective mentoring approach involves A. Critiquing performance without feedback. B. Providing constructive feedback, modeling professionalism, and encouraging self-reflection. C. Allowing complete independence without oversight. D. Focusing only on administrative responsibilities. 11. Which of the following reflects proper regulatory compliance under ACSM standards of practice? A. Sharing client health data with peers for discussion. B. Documenting client progress accurately and maintaining confidentiality. C. Posting client progress photos without written consent. D. Delegating medical decision-making to unqualified staff. 12. What is the correct order of the pre-participation screening process according to ACSM? A. Health history, exercise test, risk classification, and goal setting. B. Health screening, risk classification, medical clearance, and exercise prescription. C. Exercise test, health screening, medical clearance, and risk assessment. D. Goal setting, risk classification, health screening, and prescription. 13. In the context of curriculum development for an ACSM certification course, which component ensures measurable learning outcomes? A. Ambiguous objectives. B. Clearly defined learning objectives aligned with evaluation tools. C. Randomized lesson sequencing. D. Informal peer teaching. 14. During resistance training, which breathing technique minimizes the risk of dizziness and excessive blood pressure rise? A. Breath holding during the concentric phase. B. Valsalva maneuver during lifting. C. Exhaling during exertion and inhaling during relaxation. D. Rapid shallow breathing. 15. When evaluating client adherence to an exercise program, which method provides the most reliable measure? Verbal self-report only. B. Attendance tracking and performance progression records. C. Client satisfaction survey. Informal observation. 16. Which component of mentoring most influences long-term professional growth? A. Technical instruction only. B. Emotional support, feedback, and professional development planning. C. Assigning additional workloads. Minimizing mentor-mentee interactions. 17. Which of the following tests best evaluates muscular endurance? One-arm squat. B. Push-up test to fatigue. C. Vertical jump test. D. Sprint test. 18. A client with type 2 diabetes begins a new aerobic program. What is the safest initial recommendation? A. High-intensity interval training immediately. B. Moderate intensity exercise 3-5 days per week with glucose monitoring. C. Vigorous anaerobic exercise daily. D. Strength-only training to manage insulin. 19. Which evaluation method most accurately measures learning in an ACSM continuing education workshop? A. Participant attendance alone. B. Pre- and post-assessments measuring knowledge application. C. Participant enjoyment surveys. D. Instructor self-evaluation only. 20. What is the best strategy for developing a curriculum in exercise physiology for adult learners? A. Include case studies, active problem solving, and real-world application. B. Focus exclusively on theoretical concepts. C. Use repetitive drills without context. D. Limit learner input. 21. Which ACSM guideline applies when designing exercise programs for obese clients? A. Prioritize flexibility training only. B. Focus on balance and stability exclusively. C. Combine aerobic and resistance training to promote fat loss and metabolic health. Emphasize anaerobic sprints. 22. In an educational setting, summative evaluation is best described as A. Continuous feedback throughout training. B. Final measurement of learning outcomes after course completion. C. Informal observation during instruction. D. Initial needs assessment. 23. The ACSM's recommended warm-up duration before moderate intensity exercise is A. 1 to 2 minutes. B. 5 to 10 minutes of low-intensity activity. C. 15 to 20 minutes of static stretching. D. No warm-up is required. 24. What is the most appropriate adult learning principle for teaching exercise testing protocols? A. Encourage active participation and critical thinking. B. Emphasize rote memorization of procedures. C. Limit questioning to save time. D. Focus solely on instructor demonstrations. 25. Which document ensures compliance with ethical standards in ACSM professional practice? A. Client payment records. B. Informed consent and confidentiality forms. Marketing plan. D. Trainer's certification card. 26. The most effective communication strategy for explaining VO2 max results to a non-scientific client is A. Use analogies in plain language to explain performance capacity. B. Present raw data without context. C. Use complex terminology to enhance professionalism. D. Avoid interpretation to reduce liability. 27. Which of the following represents a violation of ACSM professional ethics? A. Refusing to train a client without medical clearance. B. Guaranteeing weight loss results within specific timeframes. C. Documenting adverse events accurately. D. Maintaining client confidentiality. 28. What should an ACSM EP do if a client refuses to complete an informed consent form? A. Proceed with training. B. Allow participation under verbal agreement. C. Delay participation until consent is signed. D. Have another trainer sign in their place. The key purpose of the ACSM risk classification process is to A. Exclude all high-risk clients. B. Determine the need for medical clearance and guide exercise prescription. C. Diagnose medical conditions. D. Predict athletic potential. 30. In mentoring, which method promotes reflective learning? A. Assigning written self-assessment logs after sessions. B. Avoiding feedback. C. Providing only positive reinforcement. D. Limiting discussion to performance metrics. 31. Which of the following would be considered a violation of HIPAA guidelines in ACSM practice? A. Sharing anonymized case data. B. Discussing client health with unauthorized individuals. C. Maintaining secure client files. D. Reporting safety incidents to supervisors. 32. What is the primary objective of a post-program evaluation in ACSM practice? A. To measure participant enjoyment only. To determine the effectiveness of the exercise program in achieving goals. C. To confirm attendance. D. To evaluate instructor satisfaction.